One moment, your dog is happily wagging their tail, begging for breakfast like always. The next, they're standing over a puddle of vomit on your kitchen floor. Maybe it happened just once, and now they're acting completely normal. Or perhaps they've thrown up several times in a single day, and you're starting to wonder if this is something serious. If you've ever found yourself asking, should I be worried, or will this pass on its own? You're not alone. Vomiting is one of the most common reasons dog owners call or visit their veterinarian. But here's what makes it so confusing. Sometimes it's caused by something as simple as eating too fast, while other times it can be the first warning sign of a life-threatening illness. The challenge is knowing the difference. Many owners assume that if their dog is still wagging its tail or asking for treats after vomiting, everything must be fine. Unfortunately, that's not always true. Dogs are incredibly good at hiding discomfort. By the time obvious symptoms appear, the underlying problem may have already progressed. That's why understanding the warning signs matters so much. In this video, we'll explore 7 important signs that can help you decide whether your dog's vomiting is likely to be a minor issue or whether it's time to contact your veterinarian without delay. Along the way, we'll also explain why dogs vomit in the first place, what common mistakes owners make, and what you should and shouldn't do if it happens to your pet. Let's start with the question every dog owner asks first. Why do dogs throw up at all? Vomiting isn't actually a disease, it's a symptom. Think of it as your dog's body trying to get rid of something that shouldn't be in the stomach or reacting to a problem elsewhere in the body. Sometimes the cause is harmless. A dog may eat too quickly, swallow grass, or snack on something that doesn't agree with them during a walk. In these situations, vomiting may happen once and the dog quickly returns to normal. But vomiting can also happen because of infections, intestinal blockages, food allergies, poisoning, pancreatitis, liver disease, kidney disease, parasites, stomach ulcers, hormone disorders, or even certain types of cancer. The same symptom can point to dozens of very different conditions. That's why veterinarians don't focus only on the vomit itself. They look at everything surrounding it. Your dog's age, medical history, energy level, appetite, hydration, breathing, and even small behavioral changes that owners sometimes overlook. One of the biggest mistakes people make is assuming that all vomiting looks the same. It doesn't. The color, timing, frequency, and appearance of the vomit can all provide valuable clues. For example, yellow foam may simply indicate bile from an empty stomach, while bright red blood or material that looks like coffee grounds could suggest bleeding somewhere in the digestive tract. Large amounts of undigested food shortly after eating may point toward a problem with swallowing or digestion rather than the stomach itself. Even the timing matters. Does your dog vomit immediately after eating? Several hours later? Only in the morning? Only after exercise? Every detail helps narrow down the possibilities. But before worrying about identifying the exact cause, it's even more important to recognize when vomiting crosses the line from an inconvenience to a medical emergency. The first warning sign is repeated vomiting. A single episode isn't always alarming, especially if your dog quickly returns to normal. But if vomiting continues several times within a few hours or keeps happening throughout the day, it's no longer something to simply watch and wait. Every episode causes your dog to lose fluids and important minerals called electrolytes. Over time, dehydration begins to develop, and dehydration can quickly make almost any illness much more dangerous. Young puppies, senior dogs, and small breeds are especially vulnerable because they have less reserve to handle fluid loss. Even if the original problem wasn't severe, repeated vomiting alone can become a serious issue if left untreated. The second warning sign is when your dog becomes unusually tired or weak. Healthy dogs recover from minor stomach upset surprisingly quickly. If your normally energetic dog suddenly refuses to play, barely lifts their head, or seems unusually quiet after vomiting, their body may be fighting something much more significant than simple indigestion. Lethargy is often one of the earliest clues that veterinarians pay close attention to because it suggests the illness may be affecting the entire body, not just the stomach. Some owners describe it as their dog just not acting like themselves. That simple observation can be incredibly important. Changes in personality often appear before more obvious medical signs. Another warning sign that deserves immediate attention is refusing food and water. Many dogs skip one meal after vomiting because their stomach feels irritated. That's understandable, but if your dog refuses both food and water for an extended period, dehydration becomes an increasing concern. Ironically, some dogs desperately want to drink because they're thirsty, only to vomit the water back up moments later. This creates a dangerous cycle where the body can't replace the fluids it's losing. Without treatment, dehydration can worsen surprisingly fast. One simple way veterinarians evaluate hydration is by checking the gums. Healthy gums should feel moist and slippery. Dry, sticky gums may suggest dehydration. Another common test involves gently lifting the skin over the shoulders. In well-hydrated dogs, the skin quickly returns to its normal position. If it remains tented for several seconds, dehydration may already be developing. These simple observations aren't perfect diagnostic tools, but they can help owners recognize when professional care becomes increasingly important. Now let's talk about something many owners never expect. Sometimes the biggest danger isn't what your dog threw up, it's what they swallowed before they vomited. Dogs explore the world with their mouths, socks, children's toys, corn cobs, nuts, bones, rocks, hair ties, even small household objects. Many of these items cannot safely pass through the intestines. Instead, they may become lodged somewhere along the digestive tract, creating what veterinarians call an intestinal obstruction. At first, the only symptom may be vomiting, but as the blockage worsens, dogs often become increasingly uncomfortable. They may repeatedly try to vomit without bringing much up. Their abdomen may become painful. They may stop eating completely. Eventually, without treatment, blood supply to the intestines can become compromised. This is why veterinarians often ask owners one seemingly strange question. Could your dog have eaten something unusual? The answer sometimes changes the entire direction of the examination, because when a foreign object is suspected, waiting too long can dramatically increase the risk of complications. And here's something that surprises many owners. Not every dangerous cause of vomiting starts in the stomach. Sometimes the stomach is simply reacting to a disease somewhere else in the body: kidney disease, liver disease, hormonal disorders like Addison's disease, certain infections. Even severe pain can trigger vomiting. That's one reason veterinarians often recommend blood tests for dogs with persistent vomiting. They're not just checking the stomach, they're evaluating how the entire body is functioning. And sometimes those results reveal problems that owners never suspected. The fourth warning sign is one that should never be ignored: vomit containing blood. Seeing even a small amount of blood can be frightening, but it's important not to panic. Instead, pay close attention to what you're seeing. Bright red blood usually suggests fresh bleeding somewhere in the mouth, throat, or upper digestive tract. Dark brown or black material that resembles coffee grounds can indicate partially digested blood, meaning the bleeding may have been happening for some time inside the stomach or upper intestines. Blood doesn't automatically mean the situation is life-threatening, but it does mean your dog needs veterinary attention as soon as possible. Bleeding can result from stomach ulcers, swallowed foreign objects, severe inflammation, certain toxins, clotting disorders, or other serious medical conditions. This isn't something to monitor at home for several days while hoping it gets better. The next warning sign is severe abdominal pain. The problem is that dogs don't always cry or whimper when they're hurting. Instead, they show pain in much subtler ways. Your dog may refuse to lie down comfortably. They may repeatedly change positions, stand with a hunched back, guard their stomach when touched, pace around the room, or begin panting even though they haven't exercised. Some dogs stretch into what looks like a play bow, with their front legs extended and their rear end raised. And while this can be normal play behavior, dogs experiencing abdominal pain sometimes hold this position because it temporarily relieves pressure inside the abdomen. One condition veterinarians worry about when vomiting is combined with abdominal pain is pancreatitis. The pancreas is a small organ located near the stomach and intestines. It helps digest food and regulate blood sugar. When it becomes inflamed, digestive enzymes can begin damaging the pancreas itself instead of breaking down food. Dogs with pancreatitis often appear suddenly miserable. They may vomit repeatedly, refuse food, become lethargic, and show obvious discomfort when their abdomen is touched. Although pancreatitis can range from mild to severe, it always deserves professional evaluation because serious cases can affect multiple organs throughout the body. Another emergency that can cause both vomiting and abdominal swelling is gastric dilatation volvulus, commonly called bloat. This condition occurs most often in large, deep-chested breeds such as Great Danes, German Shepherds, Standard Poodles, and Weimaraners. The stomach fills with gas and, in some cases, twists on itself. Once that happens, blood flow is restricted, and the condition becomes a true surgical emergency. Dogs with bloat often try to vomit but produce little or nothing. Their abdomen may appear swollen or tight. They become restless, and their condition can deteriorate rapidly within hours. Recognizing these signs early can literally save a dog's life. The sixth warning sign involves vomiting that continues for more than 24 hours, or vomiting that keeps coming back over days or weeks. Even if your dog seems fairly comfortable between episodes, repeated vomiting should never be dismissed as just a sensitive stomach. Chronic vomiting may point toward inflammatory bowel disease, food intolerance, parasites, chronic kidney disease, liver disorders, stomach ulcers, or hormonal conditions. Sometimes owners become accustomed to occasional vomiting because it has happened for months. They begin thinking, that's just how my dog is. But healthy dogs should not vomit regularly. If your dog throws up every few days or every few weeks, that's a pattern worth investigating. Finding the underlying cause early often leads to better outcomes than waiting until symptoms become severe. The seventh, and perhaps most important warning sign is vomiting combined with other unusual symptoms. Vomiting rarely occurs in isolation when serious illness is involved. Ask yourself a few simple questions. Is your dog having diarrhea? Are they struggling to breathe? Have they collapsed? Are they shaking? Do they seem confused? Are they drinking excessive amounts of water? Have they stopped urinating? Is their belly becoming swollen? Did they recently chew on a houseplant, medication bottle, chocolate, grapes, raisins, xylitol-containing gum, or household chemicals? Each additional symptom provides another piece of the puzzle. Veterinarians often solve medical problems by putting many small clues together rather than relying on one dramatic sign. Now let's discuss something equally important. What should you do if your dog vomits? The first step is to stay calm. Panicking makes it harder to notice the details that your veterinarian will need. If possible, observe the vomit before cleaning it up. Notice its color, whether food is present, whether there's blood, foam, grass, or foreign material. Think back over the previous 24 hours. Did your dog eat something unusual? Get into the trash? Chew a toy? Receive a new medication? Eat table scraps? These details may seem unimportant, but they often help identify the cause much faster. If your dog appears bright, alert, and otherwise normal after a single episode of vomiting, your veterinarian may recommend monitoring them closely for any changes. However, if vomiting continues, your dog becomes weak, refuses water, shows signs of pain, or belongs to a high-risk group such as a puppy, senior dog, or one with existing medical conditions, it's safest to seek veterinary advice promptly. One mistake that many owners make is offering a large meal immediately after vomiting because they worry their dog must be hungry. An irritated stomach often needs time to settle. Following your veterinarian's guidance on when and how to reintroduce food is usually the safest approach. Another common mistake is giving human medications without veterinary advice. Some medications that are safe for people can be extremely dangerous for dogs, even in small amounts. Others may temporarily reduce symptoms while making the underlying disease more difficult to diagnose. It's always better to ask before giving anything that wasn't specifically prescribed for your pet. Prevention also plays a bigger role than many owners realize. Many vomiting episodes can be avoided by keeping household toxins out of reach, preventing access to garbage, feeding a consistent diet, introducing new foods gradually, supervising dogs that like to chew inappropriate objects, and scheduling regular wellness examinations. Routine veterinary care often detects health problems long before vomiting ever becomes part of the picture. As dogs age, regular blood work can reveal early kidney disease, liver disease, diabetes, and other conditions that may not yet be causing obvious symptoms. Early detection gives both veterinarians and owners a much better chance of managing these diseases successfully. Perhaps the most important message to remember is this: vomiting itself is not the diagnosis. It's your dog's way of telling you that something isn't right. Sometimes that something is minor and passes quickly. Sometimes it's the first visible sign of a condition that needs immediate medical attention. Your job isn't to guess the exact disease. Your job is to recognize when the warning signs suggest it's time to seek professional help. Knowing those signs can make all the difference. The next time your dog vomits, don't focus only on the mess on the floor. Look at the whole picture. Watch their energy level. Notice their behavior. Pay attention to how often it's happening, whether they're drinking water, whether they're showing signs of pain, and whether any other unusual symptoms are developing. Those observations may become some of the most valuable information your veterinarian receives. Because in many cases, the earlier a serious illness is recognized, the better the chances of a full recovery. And that's one of the greatest gifts any pet owner can give their dog. Not just love, but the ability to recognize when that love means asking for help before it's too late.